Hello and welcome to Voice of Gender Studies, a channel where we break stereotypes and spread awareness about equality worldwide. Today, we're exploring how gender bias impacts healthcare, often with serious consequences. Understanding gender bias. What is gender bias in healthcare? Gender bias in healthcare happens when medical treatment, diagnosis, or research is influenced by stereotypes about men or women instead of focusing purely on the patient's needs. How it starts. Bias begins early. Medical research historically focused on male bodies, meaning women's health issues were often overlooked, misunderstood, or misdiagnosed. Underdiagnosis of women. When symptoms are ignored, studies show women's pain is more likely to be dismissed as emotional or stress-related, while men are taken more seriously for the same symptoms. Heart disease example. A deadly difference. Heart disease is the #1 killer of women, yet their symptoms often differ from men's and are less recognized, leading to delayed or wrong treatment. Pain management. Who gets more pain relief? Research shows men are more likely to be prescribed strong painkillers, while women are told to rest or relax, even for the same level of pain. Impact on men. Men face bias too. For example, mental health issues in men are often ignored because of the stereotype that men should be strong and not show emotion. Global patterns. This happens worldwide. From Africa to Europe to Asia, gender bias in healthcare affects all countries, though the reasons and severity may vary by culture. Research gap. Lack of inclusive research. Until recently, most drug trials excluded women, leading to side effects or incorrect dosages that can harm female patients. Research gap. Lack of inclusive research. Until recently, most drug trials excluded women, leading to side effects or incorrect dosages that can harm female patients. Role of medical training. Education shapes care. Medical schools must teach future doctors to recognize bias and treat patients based on individual symptoms, not gender assumptions. Stories that matter. Real-life impact. Countless women and men have shared stories of delayed diagnoses, unnecessary suffering, and even loss of life because of gender bias in medicine. Breaking the cycle. What can we do? Raise awareness, demand gender-sensitive research, and support health policies that ensure equal care for all. Role of technology. AI and better data. With better data and artificial intelligence, we can detect and prevent gender bias in medical decision-making. Your role. Every voice counts. As patients, we must advocate for ourselves and others, questioning assumptions and pushing for fair treatment. Call to action. Together for equality in healthcare. Gender bias in healthcare is a problem we can solve together, but it starts with awareness and action. Closing and engagement. Voice of Gender Studies. Thank you for watching Voice of Gender Studies. If you believe in equal healthcare for all, hit the like button, share this video, and subscribe. And don't forget to leave a comment. Your voice matters.